Hello, and welcome to MetroPsychologist, your go-to channel for expert advice on relationships, dating, work-life balance, and organizational psychology. Whether you're navigating the complexities of modern relationships or seeking to improve your overall well-being, you're in the right place. Today, we're diving into an important topic that often causes confusion. What is the difference between a psychologist and a therapist? And who should you choose for your mental health needs? Understanding the differences between a psychologist and a therapist. When it comes to mental health, finding the right professional is crucial for effective treatment. However, the distinctions between various mental health professionals can sometimes be confusing. Two terms that are often used interchangeably but have different roles are psychologist and therapist. Understanding these differences can help you make an informed decision about which type of professional is best suited for your specific needs. Who is a psychologist? A psychologist is a mental health professional who holds a doctoral degree in psychology, PhD or PsyD. Psychologists are trained in the study of the mind and behavior and are experts in diagnosing and treating mental health disorders. Their education includes extensive coursework in areas such as cognitive, emotional, and social processes. They are also trained in research methods and scientific principles, which allows them to use evidence-based practices in their treatment approaches. Psychologists often work in clinical settings, private practices, hospitals, or academic environments. They may specialize in specific areas, such as clinical psychology, counseling psychology, or forensic psychology. In clinical settings, psychologists assess and diagnose mental health conditions through interviews, psychological tests, and observations. They also develop and implement treatment plans, which may include therapy and other interventions. Who is a therapist? The term therapist is broader and can refer to various types of mental health professionals, including psychologists, social workers, counselors, and marriage and family therapists. Unlike psychologists, therapists may not necessarily have a doctoral degree, but they typically hold a master's degree in a related field. Therapists are trained to provide counseling and psychotherapy to individuals, couples, families, and groups. Therapists focus on helping clients navigate life challenges, such as relationship issues, stress, grief, and personal growth. They use various therapeutic techniques to support clients in managing emotions, developing coping strategies, and achieving their goals. Depending on their training and licensure, therapists may specialize in areas like cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, psychodynamic therapy, or family systems therapy. Key differences between psychologists and therapists. Educational background. Psychologists require a doctoral degree, PhD or PsyD, in psychology. Therapists typically hold a master's degree in fields like social work, counseling, or marriage and family therapy. Scope of practice. Psychologists qualified to diagnose mental health disorders, conduct psychological testing, and provide evidence-based treatments. Therapists focus on counseling and psychotherapy, helping clients work through emotional and relational issues. Licensure and certification. Psychologists must be licensed by state boards to practice psychology, which involves passing a licensing exam and meeting specific educational and training requirements. Therapists' licensing requirements vary by state and specialty. For example, licensed professional counselors, LPCs, and licensed clinical social workers, LCSWs, must meet state-specific criteria for licensure. Research and academia. Psychologists often engage in research and contribute to the academic study of psychology. They may publish research findings in scholarly journals and teach at universities. Therapists. While some therapists may be involved in research, their primary focus is usually on providing direct care to clients. Treatment approaches. Psychologists use a variety of evidence-based treatments tailored to specific mental health disorders. These may include cognitive behavioral therapy, psychodynamic therapy, and other specialized interventions. Therapists employ a range of therapeutic techniques depending on their training, such as talk therapy, behavioral therapy, and solution-focused therapy. Who should you choose for your mental health issue? Choosing between a psychologist and a therapist depends on several factors, including the nature of your mental health concerns, your treatment preferences, and the type of support you need. Severity of mental health issues. If you are dealing with a severe mental health disorder, such as major depression, bipolar disorder, or schizophrenia, you may benefit from seeing a psychologist who can provide a comprehensive diagnosis and a structured treatment plan. For more general emotional and relational issues, such as stress, anxiety, or relationship conflicts, a therapist can offer valuable support and counseling. Need for psychological testing. If you require psychological testing or assessments, such as IQ tests, personality tests, or diagnostic evaluations, a psychologist is the appropriate choice. Therapists typically do not conduct psychological testing but can refer you to a psychologist if needed. Preference for evidence-based treatment. If you prefer a treatment approach grounded in scientific research, a psychologist may be the better option, as they are trained in evidence-based practices. Therapists also use evidence-based techniques, but their approach may be more flexible and tailored to individual client needs. Personal connection and comfort. Regardless of credentials, the therapeutic relationship is key to effective treatment. It's important to choose a professional with whom you feel comfortable and connected. This connection can greatly influence the success of therapy. Cost and accessibility. Consider your budget and the availability of professionals in your area. Psychologists may charge higher fees due to their advanced training, while therapists may offer more affordable options. Some mental health professionals offer sliding scale fees based on income, making therapy more accessible. Conclusion: making the right choice. Both psychologists and therapists play vital roles in supporting mental health. The decision between the two should be guided by your specific needs, the severity of your condition, and your personal preferences. Whether you choose a psychologist or a therapist, the most important factor is finding a qualified professional who can provide the support you need to improve your mental health and well-being. If you're unsure which type of professional is right for you, consider consulting with your primary care physician or a mental health advocate who can help guide you to the appropriate resources. Thank you so much for joining us today on MetroPsychologist. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe to our channel for more insights on relationships, dating, work-life balance, and more. We're here to help you live a happier, healthier life. See you in the next video.